And he's like, how are you going to feel about this moving into this big administration role? I said, I don't know what you're asking me, homie. Like, be for real. Like, stop beating around the bush and being on the fucking, I'm going to say the word, being a little bitch. Like, be a man and ask me what you want to ask me.
Yeah.
Are you asking me, am I going to be angry at myself from leaving all my students because I care about my students more than anyone else? Yes, I processed that. I've been angry. I'm mad.
Right.
I'm sad about it. But I know what I got to
Conflicted,
do.
all of it.
I got to change the system more, and I can't do that as a low-level clinician. I need to go up. And a lot of people don't like the way I talk. And so that's why me and Spence talk about being autistic or neurodivergent or blunt or of color or a woman of color, God forbid, and how they look at us in interviews and like, nope, not you. You're too smart. You talk too much shit. We can't control you. So we're going to hire Bethany, who's going to be a good little girl, know her role, shut the fuck up and just fit in. Well, a lot of us can't do that. A lot of us won't do that. A lot of us don't want to betray ourselves more than we already have. As that scene in Andor says, what have you sacrificed? Everything. I use the tools of my enemy to succeed in life. And I don't even know if it's going to fucking help or if I ever see the wake of the morning. Like this one scene in Andor, like it's fucking one of the best in Star Wars.
It is. It's like probably one of the most used scenes on like social media. It's been ever since it came out. It's amazing.
Bro, the
it's a
tools of my enemy, I've been using that for a lot of my immigrant women because you're using the tools of your enemy to fit in this white society.
No, I agree with you 100%. And even though I'm not neurodivergent,
Girl, you ain't normal. I'm gonna be real with you.
No, I ain't normal. And my whole life, my mouth has gotten me in trouble. But at the same time, my mouth has also been a huge role in advocacy.
Yep.
You understand what I'm saying? And so I take risks every time I come on a podcast because I'm supposed to be Dr. Haji and I have to testify in courts and I have attorneys and judges and very, politicians and people that look at me as you're supposed to be the forensic expert witness. And then you're going on, you're talking about 30 vaginas. And so it's a risk. But at the same time, I can't live my life, there's limits and there's boundaries and I adhere strictly to my ethical code, which I always will do no matter what crap I'm talking on a podcast. So I think that's number one. Number two, I think authenticity is required to live a peaceful, serene life. I can't go in there like you were talking about, Dr. Nas, and be somebody that I'm not. And advocacy is in my blood. And so, and I'm not saying I advocate outside the parameters. I'm not saying I never have, but outside the parameters. But like you said, I'm already coming from a 1 down position, 2 down, 3 down, whether it's you're neurodivergent or you're a woman or you're I'm an immigrant. I wasn't born here.
Immigrant, whatever.
Or you're a person of I'm mixed or you're mixed. We're already on coming down. So for me to come up and be like, I'm Dr. Haji, take me seriously, but yet I'm on this podcast talking about whatever I'm talking about, it's like I'm taking a big risk. But to me, it's worth it because I sleep well at night. I do.
Good. Yeah, you ain't ADHD and autistic enough if you sleeping good. We ain't sleeping good over here, homie. Yeah.
But, well, I mean, I didn't say I sleep at night without the aids of something.
Oh, hey. Is it me, bro, or is it every time she mentions? I'm not going to use the word again, but every time you mention the 30 things,
the JJs,
I see them wrapped in like a McDonald's wrap. Like they look like little Big Macs. Like they look like 30 Big Macs in my freezer. It's not even a vagina.
Hungry.
It's just a Big Mac.
Well, okay, so I've gotten this
that special sauce.
I don't know. Have you guys ever watched Louis C.K.'s stand-up specials?
Yeah. Oh, not stand-ups, but yeah, go ahead.
Okay, because one of his stand-ups, he's talking about how he's in traffic and somebody says, suck a bag of dicks. And he's like thinking, like, what does a bag of dicks look like? Are they all like smushed together in a plastic bag or are they all standing up in a brown paper bag like baguettes? Right? He was like, yeah, no, I'm gonna send you this bit as soon as we're done. So he's like, what does a bag of dicks look like? And I feel like you're having the same
that hypervisual. I feel like for me, the bag of dicks would just be like a bunch of them and like a big meatball. It would look like a big meatball.
Would you want? Because I can give you the answer. I read the arrest report. I can give you the answer. Or do you want to just
what the JJs look like?
No. I'll literally it'll traumatize
ruin it,
me.
right?
No,
I would ruin it.
No, it wouldn't ruin it. This is like a very like Big Mac thing. This is like
so
fun.
I won't tell you.
No. My mind is very graphic and the autism and the
I won't tell you.
hyper-empathy
I won't. Okay. I do know the answer. I read the arrest report, but I won't tell you.
No, I don't need. I've read enough arrest reports.
Okay.
No. Okay. My own.
Yes, I did do that.
He was nibbling on the toes. What?
He wouldn't stop.
He beat him to death and then nibbled. Let me stop.
He put Big Mac secret sauce on him.
Polynesian
what does
man.
that mean?
Yeah.
What does that mean?
Racism.
Anyways.
In that arrest report. Racism.
Yeah, racism.
Yeah.
Racism.
They pigeonholed me, man, in that report.
I do want to go back to like what you said. Would love to ask you. So you talk about having like a relationship with like, your patients, clients, and how it's more black and white, or you want to keep it that way just for just for the sake of like having that relationship, just have it black and white. But the action of therapy itself is a gray area, and you have to stick in that gray area, or else you can come off as unauthentic, and then why would I talk to you if you're
totally
unauthentic? So would love to know, like, what are your thoughts on like just keeping that gray area, but then also making sure that your relationship is black and white as well?
Yeah, I think that's a great question. And I think that that's a great question for any clinician who works in any kind of setting with any patient, right? Because you want to be authentic. And there are times where I've really wanted to self-disclose because I lived, my life has not been straight. It's been zigzag. And I've had a lot of my own experiences. And there's been time where they're like, especially when they're trying to test you, you don't know what that's like, doc. You don't know what that's like. And you want to be like, actually, I lived in the Bronx for 7 years. Let me tell you that I know exactly but you can't do that, because that's not how we're trained.
Yeah.
And you have to go back to your training and your clinical skills. And not everything is in the book. Also, I don't think the best therapists are just doing what we learn in the book. I think the best therapists, I'm sure you can agree with this, Dr. Nas, is those who can build genuine rapport and alliance. So when I say it needs to be black and white, I'm strictly talking about like ethical boundaries, right?
Yes.
You are unfortunately incarcerated and you are my patient, and I am not incarcerated and I am your clinician. That is black and white. As far as the rapport and the alliance, that, like I say with everything else, needs to be individualized. I'm not going to talk to a very, very dangerous, potentially still violent serial killer the way I'm going to talk to an autistic juvenile delinquent who is experiencing depressive symptoms in juvenile detention center. And any clinician who does talk to those people the same way probably shouldn't be a clinician.
Yep.
So it has to stay gray. I think it has to be gray. There's no other way. Yeah. It has to be gray, and yet the ethical confines of my profession have to be black and white.
Yep.
Yeah. That makes sense.
Totally.
So Spence, I'm going to kick out an idea real quick just between me and you. I think we're going to do this in a 2-part series because it's a magnificent conversation and it's going to be close to an hour. So I'm going to do this as a 2-part series. I'm going to do it as an interview for everyone that's paying attention to this. And then me and Spencer will do a promo for it. And then we're going to actually do the actual movie breakdown because I feel like that's going to take time. So we're going to do a 2-part series, 2 episodes, release them in the same week, not 2 separate weeks. That way people can ingest it in a little bit more palatable ADHD like experience because they're all neurodivergent as shit.
Oh, so I feel like it took up too much of you guys' time now.
No, this has been
perfect.
Right.
Yeah, no. When we can have just conversations and just not only just have serious conversation, but then also just bullshit around a little bit.
We've never had anyone with your mind. So this is a different mind for us to like ingest.
Compliment or insult?
Maybe a little bit of both.
No.
Maybe.
Why would it be an insult? I'm like, this motherfucker, you got all the, what did he say in Brooklyn Nine-Nine? Oh, I'm not going to say that.
Yeah, there you go.
No, because he said.
You said you were working on your filter and you're doing so well.
Yeah.
You said I'm not going to say that like 4 times now. I'm like genuinely proud of you.
Because
he literally compared some toes to a McRib.
I know, but he also said I'm not going to say that like 4 times. So
because in the show he's like, my brain is hard.
He's about to say
it's rock hard, and he's like, and then the Captain Holt, he's like, that's wrong. Your brain is like soft and wet. And so I was like, you got a moist brain.
He said it. He couldn't stop.
But I didn't mean it in that way. But people are going to think that I mean it.
Right there. He's like, I won't say it.
People are going to think that I mean it as a pervert. I'm not a pervert.
By the way.
I'm not a pervert.
I'm not a pervert. All right? I'm not a pervert.
I'm not a pervert.
Oh, that was good.
That was French. I was trying to do Arnold, but as a French.
Oh no, my mother's French. So she's been living for 40 years and she still talks like this. So yes.
So,
French is actually my first
can you speak a lot of languages?
I feel like you
only
can.
French and English. French was my
Oh,
first language.
okay. I mean, hey,
My dad spoke 9. My dad spoke 9. He was a freak. He was in Mensa. He might have been on the spectrum. I don't know.
Girl, you ain't normal. Let's be real.
Yeah, no, I know.
Yeah,
I know.
I know.
You closer to our side
That's a
over
good
here of the
thing.
bridge. Yeah.
Oh, that's why Dr. Mac and I get along so well, because she's always like, "Are you sure?" And I'm like, "Yeah, yeah."
No, she
I'm
ain't
well,
normal.
no, she ain't normal, but she's so awesomely unnormal. But neurodivergent people are my people because, yeah,
You
guys
fit
do
in with
make-
us because you're.
Yeah.
I take that as a real like honor that you accept me.
Hey, thanks for watching this video. Check out the full episode on our channel and anywhere you find podcasts. Also, remember to like and subscribe. Whoop whoop.